welcome back to the Nonprofit Spotlight. Glad that you are here with us again today. I am so excited to have Lynette with us. Lynette, do you mind just taking a moment and saying who you are, what your title is, and what organization you're the leader of?
Hi there, Pastor Mike. Yes, I'm thrilled to be with you all today. I'm Lynette Sappe-Watkins, and I'm the Executive Director of Culmore Clinic in Falls Church.
Great. Whereabouts is the clinic located?
So we are right between Culmore and Seven Corners, kind of in that Bailey's Crossroads to Seven Corners corridor. We're located in the First Christian Church of Falls Church. They donate space to us, and we operate a full service medical clinic for those in our community who don't have access to health insurance.
Nice. And it's a beautifully recently renovated space. Is that right?
It is a fairly recently renovated space, as many church basements are. It is formerly nursery space, and the church was very generous in offering us close to 3,000 square feet of this space, and we've been able to take that space, make it our own, and we worked with a third party, also a nonprofit, the Oasis Alliance. They are specifically focused on trauma informed design. And because so many of our patients are from environments where they had trauma in their home countries, and then it was traumatic to get here, and then living in the US can be a little traumatic. We knew that a trauma informed designed space would be a space that would be more welcoming to our patients.
Yeah, it really is a fantastic space. Very,
Thank you.
very inviting for sure. Yeah. So, did the Culmore Clinic exist before that space, or maybe you could tell us a little bit about how the Clinic came to be?
Yes, we did exist before this space. This is our third location. I have only been with the organization since 2023, but we were founded in 2007, and we started out at the result of a task force put together by St. Anthony of Padua. They had a task force to find out what were all the needs in the community, and it didn't just focus on healthcare; it was all kinds of community need. At the end of that, two of the task force participants, Terry Lavoie and Ann Cartwright, they got together and said, health really seems to be the key thing that's missing in our community. Health for those who don't have access to health insurance. And so they took it on as their own task. And St. Anthony's was at that time willing to be a fiscal sponsor for Culmore Clinic, as it came to be known. And it worked or operated under the umbrella of St. Anthony's until 2013. And that's when we became an independent 501c3 organization. Started off working just a couple of days a week at Dar al Hijra, providing some more, I'd say, walk-in clinic type of services. And then it's evolved since then. We've been in some Fairfax County space. The folks at Columbia Baptist let us use their Glen Carlin location for a period of time. And then we had an opportunity to come here to the First Christian Church of Falls Church, which gave us more permanent space and also the ability to expand. As so many operations start out in their infancy, we were kind of almost pop up in those early years where we would set up, provide services, store everything away. And we did that for a number of different years before coming here to our First Christian Church location in 2019.
Wow. So you've obviously grown since that initial idea, if you will, in 2007. So how do you go about measuring success, or is there like specific achievements that come to mind over the history of the organization?
All kinds of ways that we can measure success. But I think one of the key things to help people understand our growth is that we throughout our history have been able to grow pretty consecutively year over year in the number of patients that we serve. Of course, the caveat to that would be the pandemic, because so many things shut down, everything went to telemedicine. There wasn't so much a growth pattern at that time, but more of a maintenance mode. But the need for healthcare services is very strong here in Fairfax County. And so it's remarkable how many people are reaching out to us day by day to learn about our services and to see if they're eligible to become patients here at Culmore Clinic. So, to give you an idea, just in the last 18 months, we have more than doubled the number of patients that we serve. We are at just under 800 patients right now, and we are on a track to probably get to at least 1,200 by this time next year.
Oh my
So,
gosh.
and I'm estimating that based on the numbers of new patients that we see every single month, which ranges between 30 and 50.
Wow. So that's a lot of patients, especially
Hmm.
growing up to 1,200. So maybe you could share a little bit about what are the services that you provide, because I'm guessing all those patients have different needs that you all could address or handle.
Hmm. Well, we are a full service medical clinic, so we serve as the primary medical home for our patients, and we provide um, basic primary care services for those people that just need to come once a year for their annual checkup, as well as working to help patients with chronic diseases that might be type 2 diabetes or hypertension or hyperlipidemia. We help patients at all health levels be able to manage their chronic conditions. And to give you an idea, about a third of our patients are healthy and good shape, only need to come about once a year, but two-thirds of our patients need to come and see us on a regular basis because they're medically managed with medication, or they are participating in some of our diet and lifestyle programming. We have some diabetes workshops, some nutrition workshops. So there's a variety of reasons why people might come to the clinic. In addition, we're providing behavioral health services as well, both in person and by telemedicine. And our one of our crowning jewels is our Vision Suite, where we have, in fact, you can see we've got our a
Yeah,
little eye chart right behind me here.
looks great. Yeah.
Uh, and that was for the ribbon cutting last year when we opened our Vision Suite.
Wow. Fantastic. That's such a variety of services and such a variety of ages too. That's fantastic.
Yeah. Uh, the majority of our patients are between 25 and 54, so they're in the prime of their work life. But we do see adults 18 and up.
Wow.
That's our focus point. We do not see children. Children have other resources in the community. Adults, we want to be able to be available to them because they do need to stay healthy. They need to be able to get to work and to care for their families. So we want to provide barrier-free healthcare services so that they can focus on other things in their lives.
Yeah. So being so ingrained into like the low income and immigrant communities, have you noticed there's any particular barriers or challenges for that particular subsets of our culture, our neighborhoods that you guys are able to address or to help with?
Yes, there are a number of things, and I know they won't surprise you or your audience. We have everything from the fact that they just don't have basic insurance, and in this country, insurance is the real key to being able to get health care.
Hmm.
So they don't have insurance. Oftentimes, they don't have disposable income that would allow them to go private pay to seek health care. Transportation can sometimes be an issue as well, in that they either need to be on a bus route, which fortunately we are, or that they can walk, because not everybody has access to a car. And of course, language barriers are also something to be considered as well. And for that, we offer interpretation services either in person or through a system called Voice, that's specifically a live person that comes on the line to support a patient during their medical appointment.
Oh wow! How many different languages do you like support or have access to in terms of client resource?
So, our primary on-site language is Spanish, and most of our patients, about 95% of our patients are Spanish speakers. Other languages are supported by this language line, and it is a wonderful program because all we have to do is select the language that we want. I would almost say it's limitless, but there might be some indigenous languages that are not included, but pretty much any language that we might need, whether it be, Russian or Afrikaans, whatever it might be, Portuguese, etc., we can get through the language line.
Annette, in thinking about the variety of services that you provide on a regular basis, I was also thinking about the importance of education, just for our own self-awareness, but also um, the types of care that's out there that could be provided for someone who has a particular ailment or need. Do you all provide classes or education in any kind of way?
That's a great question, Mike. And yes, while a lot of health education help happens one-on-one with a provider, it's also proven that when people gather together to learn about their disease, or to learn about a way to improve their health, they often will become more accountable and more comfortable. So we have diabetes workshops where we gather together cohorts who go through a 7-week program on how to change their diet, their lifestyle, to manage type 2 diabetes, or in some cases to reverse it. And so we've been doing this for the last 3 years. It's a wonderful opportunity to bring people together who all have the same diagnosis. They play off one another. They're all learning together. When one person asks a question, everybody benefits from the answers to that question. Or they think, oh, I didn't think of that question, but boy, that's good information. So we have found that that is a great way to be able to help our community understand a very common diagnosis of type 2 diabetes. And a little anecdote about that, in our cohort that occurred last winter, the cohort put together a cookbook of recipes that they like to serve in their home. And their challenge was to make it heart healthy, to put together a version of their favorite recipe that fit with the guidelines they'd been learning during the course of their workshop. And so at their graduation from the program, they all received not only a certificate saying that they had completed the program, but they all received a copy of the cookbook, which had everybody's heart healthy recipe. And it was really wonderful to see people flipping through the book and pointing to their recipe and nodding, and everybody was very proud that they were able to contribute. Now, keep in mind, this was a Spanish speaking class, and I don't speak Spanish, but I speak smile, and I speak happy, and I saw just the joy that these individuals were able to share with one another, that they were part of something that contributed um, to something that everybody could benefit from.
Wow. And I think that just speaks to the power of the Culmore Clinic and the fact that somebody who may have just gotten a recent diagnosis that could be pretty scary, or something that causes fear in their life, they're part of this group. And at the end, they're all smiling. They have a trajectory how to go forward and a resource to do it from. And I'm assuming some friends too along the way.
Mhm. Yes, they are. They are. And several of our former cohort members have stepped up to be ambassadors for future cohorts as well. So they're not only embracing the information, but becoming coaches for the next group to come through. So it's really been a wonderful thing to be a part of.
How about some success stories or some of the stories that come to mind from you from your time as leader in the Culmore Clinic
Mhm.
organization?
One that is a particularly important story, I think, is in reference to a woman who has been a patient here at Culmore Clinic since 2016. So even since before we were at this location. She came to the clinic in need of some work or some assistance due to some gynecological issues. And her entry point with us, we immediately were able to identify what her needs were and secure her access to a gynecologist. And she was able, through our relationships, to be able to go and see that specialist. And she eventually had to have a hysterectomy. Then once she's finished up with that process, she came back and became a patient of the clinics for these remaining years. And then last year in 2023, during her regular checkup, she received an opportunity to go get imaging. Among the services that we offer are imaging for mammograms, ultrasounds, etc., as needed or as required by the guidelines, by medical guidelines. So in her routine image examination, it was identified that she had a mass in her breast. And so that information comes back again through our relationships. We connected her with, in this case, an ANOVA surgeon who was able to confirm a breast cancer diagnosis and set her on a course through charity care to be able for her to receive. She had an surgery, she had radiation, and she had chemotherapy, all three, all through charity care associated with the relationships at Culmore Clinic. She was in the clinic just last week. She has her ups and downs. She is still recovering from all of this, but she is doing great, and she really. She's wonderful in that she allows me to tell this story, right?
Yeah.
I have her permission to talk about her and what she has gone through, and she's very thankful to Culmore Clinic that we have those relationships that can help her get that next level of care.
Yeah. So can you say a little bit more about the relationships? Are those already in place, or are those volunteers that are helping out? Or maybe you could just kind of say a little bit about like the nature of your relationships and how that works to get such amazing care for an individual that has a variety of serious needs.
hmm Yeah. So here in Fairfax County, of course, the primary hospital system is Inova. And we do have a relationship with Inova that when our patients need some specialty care that's not covered in the clinic, we do have some specialists that come to the clinic once a month. We have a cardiologist, we have an endocrinologist, we have a nephrologist. So we can cover some things in the clinic. But when those needs come up that we have to go beyond what happens right here in Culmore Clinic, we have relationships with Inova. They have a charity care program. We help our patients to apply for that. And through that relationship, we're able to connect them with other specialists. Those specialists still communicate back with the providers here at Culmore Clinic so that our providers who are caring for their day-to-day issues understand what's going on. So we're very much in communication with those providers from Inova when we have to depend on them. There are some other relationships in the community, some one-on-one relationships with physicians. For example, we have an endocrinologist who, for our more complicated diabetes patients, will send our patients to that particular endocrinologist who provides his services to the clinic. And then there are some other relationships. Again, they're, one off where you develop a relationship with a particular provider and they might give a significantly reduced fee. Now,
Mm.
when that's the case, the clinic absorbs that because again, we're trying for barrier-free care. We're
Yeah.
trying to make sure that our patient does not pursue the care because they might have to pay for it. So
Gotcha.
we really work towards negotiating with those outside physicians, or providers, in a way that that they do not have the brunt of the expense, or are not surprised with a bill that they
Yeah.
likely are not able to pay for.
Yeah. Oh my gosh. Wow.
Healthcare is
Okay.
expensive.
Yeah, absolutely. So, in order for the wheels and the gears to continue to be turning at the Culmore Clinic, do you have both paid staff and volunteer staff? And maybe you could say a little bit about the size of both.
We do. As a matter of fact, our clinic is really founded on a volunteer model. That's the philosophy that that our founders put together. That it would be primarily volunteer driven. As we have gotten larger, we have a combination of volunteers and paid staff. We have 12 people on staff. There are three of us that are more in the administrative side, and the other nine are all on the clinical side and working, direct to patient. And so the remainder of our staff would be our volunteer staff, and there's more than 100 individuals from our local community who come and support us at Culmore Clinic. And when I say come, they don't always come on site. We have some that are more virtual in support. For example, to get the process started, our patients go through a virtual medical evaluation, and that's essentially an intake, and it's done with a provider. And we have providers that are performing those services offsite, so that we fully understand what their medical history is, what their social history is, and so combination
Yeah,
virtual and on site that are supporting the clinic, very dependent on our volunteers.
that's awesome. Well, with 100 volunteers, that's a deep depth and breadth of people that are doing different things. Is there room for more volunteers?
Oh, there's definitely room for more volunteers. And think about it. There's room for more volunteers because, number one, the need is great, and expansion is very much dependent on our capacity to be able to bring people in and out of the clinic. Um, but also because volunteers have many different skill sets, and a clinic like ours has many different needs, and it's not
Yeah,
always just medical needs. We have, yes, we have a need for providers, for nurses, for people to interpret, but we also are running a business. It's a nonprofit business. We have a need for people that understand how to do evaluation, analytics. Help us take a look at our numbers, at our trends, so that we can anticipate for the future. Help us with process improvement. We are a growing clinic. Are there new technologies that we're not aware of that someone else might be an expert in, that could help us perform our duties in a more efficient way? So lots of different ways that we are embracing and engaging with volunteers.
yeah. So it sounds like if there's a volunteer that's possibly listening to this podcast or somebody who's interested in volunteering, there's some pretty entry level ways to be involved. But if you have even more advanced skill set and someone is still interested, you could find a place for them too.
Absolutely. We have opportunities to do everything from putting together patient folders all the way up to more sophisticated provider level interactions.
Yeah, that's great. And help me understand this. You're not necessarily just a Christian organization, you are an interfaith organization. So the people who could volunteer don't necessarily have to come from a Christian background, even though you're in a church. Is that right?
That is exactly right. We are very fortunate to be supported by the interfaith community. In fact, when Terry and Ann put the clinic together in 2007, the various faith congregations are exactly who she went to, or they went to be able to identify who could support us and in what ways. but medicine is medicine. So we are operating a medical practice. It is significantly supported by the faith community, and the faith community is coming together in a lot of different ways. Obviously, our space that we have here is one of them, and several of the spaces before that. But also, they are helping to get the word out to their congregations. Do they have folks that are working in their congregations who are physicians or nurse practitioners or physician associates, nurses that can help us to be able to expand the number of patients that we see from day to day, as well as I mentioned before, the administrative side too. Do they have accountants? Do they have HR representatives? There are many areas of expertise that can be occur within a congregation that could come over and help us to professionalize the work that we're doing here at Culmore Clinic.
Wow, that's great. I also appreciate the fact that there's many folks, maybe some that are listening, that are strapped for time in this kind of very busy Northern Virginia, Fairfax community that we live in. Could you say a little bit about ways that people could give that's not necessarily of time, but maybe in monetary gifts or specific items that you always need or could use?
Mm-hmm. Yep. Well, as a 501c3 nonprofit, we are completely dependent upon donations to be able to continue our work. We accept donations from individuals, foundations, corporations. We have a contract with Fairfax County right now that helps us to provide some services for new patients. So there being able to contribute financially is always really, really helpful to our organization. But there's other needs that we have as well. I'll give you an example. The Bailey's Crossroads Rotary Club, they provided us with some folding chairs, and those folding chairs helped us to transition from being that pop-up clinic to being able to have chairs for our folks to be able to sit in. They also have donated to us point of care blood pressure monitor. So that is a blood pressure monitor for those patients who have high blood pressure to be able to take home with them and record their blood pressure every day to be able to understand what's happening with my body. We really want to be able to empower our patients to be our partner in their healthcare. So something like a blood pressure monitor or point of care blood analysis, when you check your finger for glucose. Those are the kinds of things that when groups come to us and say, how can we help you? If they're looking to help us on from the perspective of, how can we relieve you of some of your expenses? The supplies that we have might be one of those ways.
Great. And then if people were listening, they could find a place to donate or a list of items that you might need on your website.
So that list of items that we need kind of changes so frequently. We'd
Sure.
rather just have them come and either give us a call and have a conversation about how they would like to give, and then we try to match them up with what the right way to serve or help is.
Great. Okay. Fantastic. And then could you say a little bit about, like, as you see the need growing from, you were saying about 800 now to maybe 1200 next year clients, what are some goals or ways that you're trying to grow the organization that you see over the next maybe 1 to 3 years, if you will?
hmm hmm So one of the things that we are sensitive to, because we want to be a patient's medical home. So we are growing to the point where we want to be able to set up their regular appointments. So making sure that everybody comes at least once a year. Do that check-in. Let's see how things are going. Do they need some additional coaching? Do they need an eye exam? Do they need dental? These are all services that they can receive through Culmore Clinic. So we want to make sure as we move forward, that we're seeing them at least once a year. And that is, you'd think that that comes naturally, but in the past it's not necessarily been, let's make sure that they're coming every year. It's more as needed. Now we want to be that medical home. Do the touch base. Do you need additional services? Do you need additional monitoring of your health condition?
Got it. Nice. How about going towards those goals? Is there any like big things or big needs that you have? If there was maybe a bigger donor out there that was looking to make a contribution, like that need, like growing by another 400 people is significant. So,
It is a
what else?
significant.
What else is out
Yeah.
there that you might need to make that possible?
Yeah. So, from a financial point of view, while we do have primarily a volunteer driven staff, when we can hire a provider, it really does anchor us in being able to provide consistent care.
Yeah.
So, expansion from a provider point of view would be wonderful. We'd love to be able to hire a new provider. As you can imagine, that's expensive, right? It's that's the kind of thing that is going to be in the high five figures to even six figures to be able
Yeah.
to support that. So, if there's an individual donor who's interested in supporting it, something like that, or perhaps a collective of people who can come together, that's always helpful. And then also, Pastor Mike, as I think about our future, we do have expansion planned into our operation in that there is a future housing development that's adjacent to this location here on Leesburg Pike. That's going to be a senior affordable housing multi-unit dwelling, 95 units for senior adults, and they have committed to having 5,000 square feet associated with Culmore Clinic. And they'll donate the space, but we do have to build out the space.
Hmm.
So in our future, in the next 18 months or so, we are going to need about $1.5 million. That's a big one, and we will be going out to the community to try and help us raise those funds to be able to do that. It sounds daunting um, to us, but we also have faith that the community is going to step forward to be able to support that, because the work we're doing here is really important work. So we have to have faith that people will come alongside us and believe not only in us, but in our patients, and recognize that access to healthcare is really one of the first steps to being able to thrive in Northern Virginia.
Yeah. And as you and I both know, in this area, there's lots of generous people, and so you can have that faith and that trust that this great need and the great work that you do to make it even to expand your capacity is important, and people will see that. So that's great.
Mhm.
And thanks you for putting that out there. Okay, so if on the other side of things, if there's some listeners that know somebody who is in need of some care, or maybe lost a job and lost insurance that came with it, like how does a client make their first entry into your space? Or can they just show up at any time and walk right in? Or is there an intake form? How does that work?
So they can show up. We have somebody that's on site Monday through Friday. We see patients clinically on Tuesday, Wednesday, and Thursday, but we do have people here on site and can get the process going if someone is interested in becoming a clinic patient. We do have eligibility requirements, including they must live in Fairfax County. They need to be at 300% of the federal poverty level or less, and have a valid ID. That's the basics
Mhm.
for becoming a patient. We have a team of patient navigators who can help our prospective patients uh, fill out any of those applications. And when I say applications, I say it plural, because when you apply to be a patient here at Culmore Clinic, you're also applying to be a patient with our pharmacy partner, Nova Scripts Central. They have their own application, but we do both of them at the same time so that it's easier for everyone. And because the last thing we want is for them to become a clinic patient, be prescribed a medication, and then not be able to get that. So we do it all at the same time so that we are able to fulfill all the needs of our patients.
Yeah, that's great. It seems pretty easy in terms of like a low bar of entry.
Yeah, we really work for it to be a low bar. All of our patient navigators are Spanish speakers, but as we mentioned earlier, if there is another language need, that same system we use for medical interpretation, we use for our application process too.
Great. Awesome. Is there anything that you can think of that we haven't talked about that you feel like it would be important for the community to know or you'd like to share?
Um, I would say that it's important for people to know that whatever their healthcare needs are, for the patients, you know, to not assume, oh, I don't need to go see a doctor, I feel healthy. It's better to go ahead and be an established patient because you never know what your needs might be. And therefore, to get a baseline, to go ahead and come in, establish a relationship with a healthcare provider. And that's true for our patients or for anybody, right? I guess my message is don't neglect your healthcare. Doesn't matter who you are, don't neglect your healthcare because there are things that can be happening within our bodies that we're not aware of and that can bite you if you're not if you don't keep on top of it. So just to make sure to encourage one another to see your provider. If you don't have a provider, get one. And if you don't have insurance, come to Culmore Clinic and let us help you through that process.
Yeah, and to be good neighbors in the same way that if we know somebody on our street or somewhere in our community where we live, that and we know that they may have not seen a doctor lately or may not have insurance, that this would be a great referral and as a way just to like look after each other a little bit around town.
Absolutely. And I'm so glad you used that word neighbors because that's even in our mission statement. Our mission is to advance health to our neighbors in Fairfax County who don't have access to health insurance. And it's neighbors helping neighbors,
Yeah,
whether it's through the faith community or individuals or foundations that we're able to do this work.
yeah. Well, Lynette, you are an awesome neighbor, and you and the Culmore Clinic are so important to our community, providing such an amazing resource for people and taking care of so many people and continue to grow on an annual basis. So, um, we are so thankful for you and thankful for all that you are doing and thankful for your staff and the hundreds of volunteers that you all are employing on a regular basis to care for the needs in our community. And so we thank you for everything.
Thank you, Pastor Mike. I appreciate your um, thinking of us, to be a part of your podcast and to share the good work that we're doing here. And I would encourage anyone, if you're curious about Culmore Clinic, to give me a call. I'd be delighted to introduce you to our staff and show you what we're doing here.
Yeah, thank you for putting that out there, and thank you for sharing your time with us. I know it's super valuable, and you are very busy, and we're grateful for you.
Thank you.
Yeah.